In a groundbreaking national summit held in Kisumu, advocates gathered to address the challenges faced by adolescents, girls, and young women in maintaining sexual and reproductive health amidst economic instability. Led by the White Ribbon Alliance Kenya, the summit brought together champions from across the country to understand and mitigate the struggles these individuals face. Angela Nguku, director and founder of White Ribbon Alliance, emphasized the need to empower young adolescents and women, ensuring their voices are heard for quality care. High living costs have disappropriately affected their reproductive health, leading to loss of dignity, especially for those living with HIV. The summit highlighted the early pregnancy as a significant challenge, aiming to change the narrative and restore equity and dignity for these girls. Kisumu County, with a teenage pregnancy rate of 16.6%, faces a critical situation according to Frederick Olwach, Director of Health and Sanitation. Beatrice Odongo, CEC for Sports, Gender, Tourism and Culture in Kisumu County, stressed the importance of equal treatment and targeted sensitization programs to empower adolescent girls and young women in safeguarding their reproductive health.
My name is Angela Nguku. I'm the founder and executive director of White Ribbon Alliance Kenya. We are a people-led movement for reproductive, maternal, newborn health and rights. At White Ribbon Alliance, we believe that we have to listen, and act on what women and girls tell us, because for the longest time, what we hear or what we see is that most of programs and policies are done without consultations of women and girls. And not just women and girls, but women and girls in their different diversities. We have women and girls who are nomads, who are living in nomadic setups. We have those in refugee camps. We have those living with disability. We have the rural poor. We have the urban poor and the like. And as such, for us, we believe in the power and voice of communities telling us what exactly do they need. What does quality reproductive health care mean to them? What is the right, equitable, dignified sexual reproductive health? And such, that is what we are, and that's the foundation of what we do. What we are here today is basically to understand what do adolescent young women and girls want. We want to celebrate their milestones. We've worked with them. We have built their capacity and their agency over the last few years, few months in different counties. We are here from different counties, not just the Lake region, but we have counties from Nairobi, Narok, Kajiado, and different other counties, Bungoma. And we are here basically to celebrate them, to hear them, to listen to them, to act with them, to power up their power, because as White Ribbon Alliance and as Angela myself, I believe that women and girls are born with power. A society that takes away that power and starts accusing them of not taking up that power. So we are powering them up to be able to stand up and speak up during this national summit. This is just one of the many summits that we have at county level, at sub-county level, but now at national level. And it's a yearly event that we do in different spaces and different times. So we are here basically to hear from them, to work with them, to work with our networks, because we are a movement. We work with our grassroots movement from different counties, and to also talk to the duty bearers from the different counties. I'm sure you've seen we have the directorates of health, gender, water, agriculture, and other ministries to basically understand what are they committing to do to change the narratives of these young adolescent women and girls, and how can we ensure that at the end of the day, the adolescent motherhood, the pregnancies, those living with HIV, those who are in nomadic setups and so many other spaces, that their needs are addressed, that they are getting quality care, that their voices are shaping the policies, the budgets, and the resources that they are investing.
My name is Frederick Olwach, Director, Public Health Sanitation, Kisumu County. If we look at what's going on now in terms of teenage pregnancies, we see in Kisumu County, we are at 16.6. If we look at gender-based violence, sexual gender-based violence, 18.1. And we have, like in the last 1 year, 721 youths, 15 to 24, had HIV/AIDS. So this means that we really want to empower them in terms of sexual and sexuality, their reproductive health services that they are seeking from the health facilities need to be non-judgmental, non-discriminatory, and of course provides the confidentiality and privacy that is required, and of course highest attainable level standards of healthcare that is needed as per the Article 43 of Kenya's Constitution. So we are basically here to make them talk, listen to them, and design our health programs and other interventions from the county, more so multi-sectoral, because we have agriculture, we have gender and social services, and of course health, so that we can listen to them and design an implementation program that is in line with their thoughts and what they expect of us. So basically we are here as a team, multi-sectoral, to listen to them, design programs that can be up to their needs, their felt needs, and of course now to work together as a county.
I'm Honorable Beatrice Odongo, the County Minister for Sports, Tourism, Culture, Gender and Youth Affairs, Kisumu County. As a department, it is our role to majorly do sensitization to the young girls. We all know the challenge we have in Kisumu County, and of course I know it is in all counties, not just specifically Kisumu County, but at least in Kisumu County we can speak about it because we are in Kisumu County and we are working for the people of Kisumu County. We have a very big number in terms of teenage mothers, especially in our rural areas. Of course I know even in the town setup, but now we can only talk about the data that we have within the rural areas. The only thing we can do to them, because somebody has gotten herself being a young mother, how do you ensure that she gets back to school, she views life in terms of there is something I can do after being a mother. So it is ours to do sensitization. Of course I want to call upon all the partners so that we go to the grassroots level. Can we have another meeting in Nyakach sub-county? Can we have another meeting in Moroni sub-county? Can we have one in Kisumu West sub-county? Because you get to those areas, we really find many people who are young mothers. Some of them are talented, of course, and we know talent can make somebody go somewhere. So as a department working together with the directorate that I have, we are also looking forward to create for them programs and activities that can let them, you can be a young mother, but you have a talent that you can showcase. So we are giving them such opportunity to showcase what they have. Also, what we are doing, we are working with the local partners to have programs, at least to ensure that we empower them economically, not specifically by giving them money in their hands, but just doing to them financial literacy. We partner with the Youth Enterprise Fund, the Women Enterprise Fund, so that they know the opportunities that exist within those offices that they can go for and have something to start off their businesses. So we are looking forward to moving to the grassroots, and I know very soon we'll be able to kickstart moving at the grassroots level to ensure that our young girls doesn't give up in life after becoming a young mother. But again, also we don't encourage them to become young mothers. We really encourage them to avoid it as much as possible, so that you go to get into a trap where a sister or a brother got himself.
Hello. My name is Ivona Tieno. I'm the Communications Officer at HEDSO. HEDSO is Health and Economic Development Strategy Organization. So at HEDSO we work with teen mothers, and we also work with generally the public in ending HIV, new HIV infections, teen pregnancies, and sexual and gender-based violence. Now we are very happy that there have been partners and stakeholders that have committed to ensuring that the services that they are offering or their outreaches are very comprehensive and inclusive, combining all youth, that is youth from people facing disabilities or those from very vulnerable backgrounds. We have the county government here, and they have committed to ensuring that the services that they'll be offering at their facilities will be not only youth-friendly, but correct and right, that is efficient according to the needs of these young ones.